Almost 11 months since major COVID lockdowns were lifted in Australia, a survey has found 40% of children and young people say the pandemic had a negative impact on their mental well-being. That's the finding of a National Mental Health Commission online survey of more than 4,500 children aged 9 to 17. The Commission is recommending more federal government support for mental health programs in schools.
Moving to the rhythm after a busy day at school.
Well, I feel like it's really good to be back at dance class because you get to be active. So if I've had a bad day, it just lets all my emotions out and I feel happy again at the end of the day.
Returning to old routines hasn't been child's play for all primary school students. Increased anxiety has made the transition difficult for some.
They are, we think, increasing in frequency and something to be taken seriously.
Melbourne's Royal Children's Hospital reported the number of patients presenting with mental health issues tripled during peak COVID times. And 10 months after lockdowns were lifted.
So we're still seeing much higher rates than usual and large wait lists here.
Any worries that you have, just float away with this white light.
A pilot program in Victorian primary schools helps staff identify and support students with anxiety.
So sometimes it presents as a sore tummy, sometimes it presents as not wanting to leave home, and sometimes it's about letting go of mum or dad or nan or pop or the carer when it's time to come up to class.
What we're going to do now, we're going to do our zones check-in.
This primary school, a participant in the pilot, uses daily emotion check-ins to track how students are feeling, while calming sensory activities help them to get ready to learn. While experts say anxiety is a part of life, it can become a problem without coping strategies.
When they're starting to avoid things or they can't enjoy life as much as they used to, they're struggling to get to sleep or eat.
So what can carers do to help a child who's experiencing anxiety? Well, talking to their teacher or a school welfare officer is a good first step. Then seeing a GP or a paediatrician.
One of the most important things that a GP can do is to provide hope to patients, to children, to their families, that things can get better.
Helping children get their groove back.
Let's keep dancing!
Philippa Carisbrook, SBS World News.